So I said we'd do a little bit of setup. Sean Morris is the CEO of Privia. He wrote an article in Medscape, which I think is critically important as this becomes a more popular story in the news. Primary care practices are at risk. There's a lot of money that has been given out, bailing out a lot of health systems and a lot of major corporations. We've seen a lot of those headlines. According to the American Academy of Family Physicians, 60,000 primary care practices may close between now and the end of June. We can only hope that this is an artificial number, but it's a dire warning. We need independent primary care physicians. We'll talk about several reasons why, but the biggest one is simply expense. Primary care physicians, when independent, are and will maintain and will remain integral in reducing the cost of care, and we'll see what their role is. But if we can't keep them independent, it threatens value-based care in general, and it threatens all of the work that's been done to try to reduce the cost of healthcare. And don't take my word for it, or some of the smaller companies' words for it. A group representing some of the largest U.S. employers has asked Congress specifically for a year-long ban on mergers and acquisitions among hospitals and doctor groups that receive government money to cope with the effects of COVID-19 pandemic, right? This is critically important. The government doesn't want its bailout money to go to buying up independent medical practices and changing the landscape and increasing the cost of medicine. The corporate practice of medicine, we can talk about that issue in and of itself, but we really want to prevent corporations from overtaking medicine entirely, especially if it's going to lead to an increase in the cost of healthcare. And I think there's three key ways to level the playing field between the corporations and physicians, and we're starting to see some progress along these lines, but we have a long way to go, and we all need to ensure that our health system has a level playing field, because if it doesn't, then what are we all doing? If this is just going to go to those with the best lobby and pricing doesn't matter, then what's the point? But if we really want to continue to make progress, and this is a bipartisan issue, value-based care had begun under the last administration, continues under the current one. So there's a lot of interest in supporting a level playing field and value-based care, but transparency is absolutely critical. If you don't know the price of the service you're going to get, it's very hard to start to compare services. You want to know what the price is first and foremost, and you want to know what you're going to get. What is the quality? What are the outcomes? What is the patient experience of the procedure or of the care that I'm getting? There's no industry, for the most part, in the world where you're not allowed to know what you're going to pay for the service that you're going to get until after it's done. So there's a lot of efforts by the government. I put a link here. I am going to distribute this presentation. This is a 120-page, give or take, piece by Alex Azar and some other team members of the federal government talking about how to increase competition in healthcare. And these are a couple of issues that were tackled in that piece. Yeah, it's long, but I think it's a critically important piece for people to read because this is a big issue and we're all involved in it. Site neutrality to me is such a big issue as well. How does an ambulatory surgery center at times, as an example, right, only make $5,000 to do a procedure when an ambulatory surgery center owned by a hospital gets 3 times that? It doesn't make sense. If you want to charge more, well, let's be transparent about it and let's let everyone know that it's going to be that much more expensive. But it's really just about negotiation most of the time. So it's an important issue. We should have site neutrality. The other impact without having it is if you're running a independent ambulatory surgery center and you know that if you sell, your revenue is going to increase 3 times. It's very difficult in that situation not to sell. We've seen massive consolidation in the industry, and that's a big reason why. This third piece is what is near and dear to my heart and Acadia's heart: access to capital. Healthcare is about risk. Make no mistake about it. The federal government charges or collects taxes and takes the risk of the population or of the health of our entire population. It's about risk. Probably don't collect enough taxes and expenses are too high. That's another issue. But private payers, they collect premiums, and they have to take risk on the health of all of their members. Hospital systems take risk on their patients. They're involved in these programs. Capitation programs have been around, arguably before value-based care, unless you consider it value-based care. The big players are already involved in this risk-taking game. Physicians and the independent practitioners need to be involved in this space as well. So if we can bring these capital markets that other larger corporations have access to, specifically to cover downside risk in case they didn't get enough money for the services they're providing, it goes a long way into leveling the playing field. And that is what we're trying to do. We're making tremendous progress, but it's a long way. It's a long road.